All right, I'll call the meeting Wednesday, April 5th, Winnebago County Community Mental Health Board into order. The time is 2:00. And I will take the roll. Mary Ann Abadi, present. Dr. Copeland,
Present.
Dr. Giardini, Dr. Gorski,
Here.
Richard Dick Hoonert,
Present.
Wendy Larson Bennett, Tim Neighbors,
Here.
Linda Sandquist here, Mohammed Yunus,
Here.
and welcome.
Thank you.
Jason, welcome. And at this time, we are awaiting a presentation, correct, from no presentation. Danielle will be here later in the agenda. Okay. There's Wendy. Here I am.
That's right.
All right, monthly activity report. Jason, do you want to highlight?
Sure. So, a lot of activity happening between site visits and grant reviews, and appreciate all the board members who were able to attend site visits. I think we have only 2 left, and then we will have completed all 30 programs for site visits. So again, appreciate those who are able to attend. There'll certainly be some follow-up summation of what maybe was discovered or learned through that process, and what we might do differently in the future as part of that process. Something I'd like to highlight that I think was kind of cool for where we're at in our progress is maybe 2 weeks ago, we were invited to be part of a forum through ACMI. It was in Hoffman Estates, I believe, in which we Hanover Township. But it was a forum for new boards. So there's been so many referendum across the state. There's so many new mental health boards now that are forming that are looking for feedback from the existing mental health boards. And, so we've kind of grown up a little bit, and that now we're part of the best practices and sharing what we've learned over the past few years here to some of these new boards. And I thought that was a fun moment to just reflect on how far we've come in a short period of time.
Did you do some bragging?
Of course. That's why I went. But that's really it. And just coming up, we'll talk a little bit more about the mental health events that we potentially have planned for May, and just finalizing a lot of those grant reviews. And of course, that'll be a big part of the May board meeting, or those renewal decisions.
Okay. First action item are the minute meetings from the March 2023 meeting, and I will move.
I make a motion that
Motion
the
is-
minutes be accepted. Second.
Tim is second. Any discussion? Hearing none. All those in favor? Oh, we can do that, right?
Yeah.
I look for Chelsea. She's right. All those in favor, please say aye. Same sign. Okay. The resolution 2023 authorizing funded program budgets, updates for program year 22 and 23.
Okay, so we have a guest, Christina Valdez, who is the treasurer for NAMI Northern Illinois. I will briefly summarize the resolution, and then you can ask any questions directly to her. Essentially, NAMI Northern Illinois, from their original budget, they are on target to spend less dollars in personnel because of the amount of time that lapsed for them to do hiring. And secondly, they had budgeted for occupancy. They are a tenant in Stepping Stones, actually in the building that was partially funded through mental health board funding. Stepping Stones had originally intended to collect rent from them for that. But in discussion and an evaluation of their own requirements as a nonprofit, have waived that rent, so they will not be charging any rent from NAMI Northern Illinois. That has freed up some additional funding for NAMI. And one of the things that came into conversation as part of the communications working group was trying to do a mental health education and awareness event in the month of May, which is Mental Health Awareness Month. And so NAMI has been able to secure a national speaker to come in on May 5th at UW Sports Factory, and the Park District has agreed to allow for that facility to be used for this event. And it would be a national speaker to draw a large crowd, and then there'd be an opportunity to have booths for each of the funded mental health agencies adjacent to that, so that people for an hour and a half or 2 hours before the speaking event can interact with each of the funded programs and learn more about that. So the request for change is actually the funding would be for things like the speaker, any rental equipment, and the supplies that would be needed for this event, which would all be procured through NAMI as part of their funded program.
That sounds wonderful. Any idea about the speaker?
Yes, so the speaker, I'm not sure if you're familiar, several years ago, NAMI brought in a gentleman named Kevin Hines, who had jumped off and survived a suicide attempt jumping off the Golden State Bridge. This is now, they'll be bringing in for follow-up a gentleman and a first responder police officer who had an interaction on the Golden State Bridge where this gentleman was wanting to jump, and a first responder found him, and they had a lengthy conversation in which he ended up choosing not to do that. So NAMI has been able to reach out to them. They don't do speaking tours, but Danielle reached out and asked if the two of them together would come and talk about their story and the interaction they had that day.
Wow.
And they have agreed to do that.
Right.
Yeah,
Is the date fixed? That they just make it?
it is May 5th. That's a fixed date.
So it'll be great PR for us as well as.
Yeah, as the funder, we would be co-branded on that material, and then also allow for funded agencies to come and have a booth at the space.
Do we need a motion to
Well,
transfer
we do,
money?
but she was gonna, do we need the action?
If you have questions, then you could ask, yeah, and I think this must be Danielle, but I'll admit, or maybe she got kicked off, Christine.
Do we have any ability to require our funded programs to be present? I mean, I really think it's based on the conversations we've had in the site visit. I think it's really important that everyone show up and have a presence there.
Our contracts currently do not dictate that agencies would have to attend this event, but we can certainly strongly encourage everyone's attendance, and in future contracts, if we know this type of thing will be an annual event, we could require it in the future contract.
I agree with you, though, I think.
Yeah.
We can certainly
Persuade
express,
Jason.
we can certainly express the importance.
So,
Are we waiting for Danielle?
No, I mean, that may be Christina. She might have called back in because I think she popped off. Christina, is that you?
It's Danielle and I both, yes.
We couldn't hear you initially.
Okay. So if you have questions about the budget change, you could ask.
I think it's exciting.
well, I make a motion that we make the suggested changes in the budget that would allow for the support of this event.
Second.
Any other discussion, comments? Hearing none, All those in favor of resolution?
There's money, there's money. in
Oh, my
there.
goodness.
Okay.
Okay, I will take roll call. Dr. Copeland,
Aye.
Dr. Jardine, Dr. Gorski,
Aye.
Dick Kunert,
Aye.
Wendy Larson Bennett,
Yes.
Tim Neighbors,
Yes.
Linda St. Louis, yes. Mohammed Yunus, Mariana Bobby, aye. Pass.
Okay, well, I can officially say then, save the date for May 5th.
Yeah.
Anyone watching, save the date for May 5th.
And the night,
I believe, Danielle, can you speak to that, or Chelsea, you're?
Start. Danielle is finalizing all of the details, on part of the planning, so we will get that out as soon as we have everything finalized.
and this is open to the public?
Yes. Free to the public community event.
Yes. Sorry, can you hear me?
Yes, we can.
This is Danielle. I'm hoping to send the save the date to everybody either today or tomorrow. So if anyone can share, that would be awesome. And thank you guys so much.
And
For
Danielle,
helping with
just for the record, the day before Eliminate Racism 815 is also having a community event at the Sports Factory. So I wonder if we couldn't play off one another in terms of publicity with the
Oh.
groups that are being solicited for that activity, because I think it's all about community awareness and visioning for the future. How to make this a more perfect place to live.
Definitely.
Yeah, it is an all day, and there are a lot of community leaders that have been solicited to do presentations and so on. So if I can share that with the folks that Eliminate Racism, then maybe, because they've got a pretty extensive mailing list, and I think you're involved in some way.
Somewhere. So I'm glad you brought it up because I was going to ask a question. I don't know how it can be done, but it seems there are probably several activities that are planned during the month of May, but is there a place where they're all sort of listed? Because I was aware of that. I'm very excited about this. I think Kevin Thomas is doing some kind of mental health summit or something. He's been doing things over at Nordwall. I think last year we had something, and I'm pretty sure on May the 20th, he's doing something again.
Yeah.
So I'm wondering if there's a way, I don't know that we're the ones to do it, but is there a way that as a community, we can sort of, for lack of a better word, cross-advertise or at least have, you know, how like Go Rockford will have, okay, this is what's happening.
Well,
You know, the summer, whatever.
certainly there, but, you know,
Remember in October that we do the mental health awareness for the week, and there's always like the weekly events that are distributed. They have, you know, every day there is one, or NAMI does that, actually.
I mean, we could definitely, I mean, if people are willing, we could put all of everyone's mental health month events on our website, like not just kind of like promote for others also.
yeah, I get
Yeah,
sharing, just
advertising.
sharing resources.
Just out of curiosity, how does the Sports Factory set this up? I mean, how do they use the place?
That's a
So
good
we
question.
have the, when you walk in the building, there's 4 courts on one side, 4 courts on the other. So we have 4 courts rented out for that day, and we're gonna kind of divide it. The first 2 will be the vendor space, and then food, like we're gonna do some hors d'oeuvres that Nami's gonna pay for, and then we're gonna have the other 2 courts for the like staging of speakers and the chairs, kind of auditorium style.
Okay. All right, thanks,
I
Ben.
don't know if anybody remembers, it's kind of a while back, but Blue Zones, when they came, that was actually at the Sports Factory, and they just had it auditorium style, and they're,
Yeah,
you know,
I've been to an event,
set it up there.
and you don't even think you're in a
Yeah.
sport event.
Okay, thank you.
So I think that between all of us and the connections we have personally with organizations, if NAMI has connections with most organizations, if we could sort of funnel the information to each other and do a lot of cross advertising on our web pages and Facebook pages and all that kind of stuff. So that everybody so that anybody that wants to go somewhere will have somewhere to go during the month of May, because I was just looking at second annual mental health forum that Kevin does is the 20th, and I'm sure there's other things that we're not thinking of right now that will probably be taking place. So we're small enough of a community, and we have enough connections between us. I think that things like this, you know, we can galvanize around and sort of help promote all the other things that are going on too.
True. Maybe we can find a way to just like host a public mental health calendar in some way. Maybe it's not just NAMI website, but it could be its own thing, maybe.
Yeah.
All right, well, those were the only action items for
That's
today,
right.
so, okay, glad we had such great attendance.
Yeah,
Uh,
for that. All the man.
Something.
Mohammed, this is Wendy Horse Bennett.
Hello.
Mom.
Nice to meet you. I figured it out, but it's like. Welcome.
Will we, have a booth there?
Yes, we have a tablecloth also that was purchased, I think, when we did the polos.
Okay.
Yep. And we have the different publications that we can hand out there. We did a large order of the program handouts, and we'll do the, once the impact report is finalized, we can do a certain number of those, so all those are more pages, so a little higher cost, but we'll have a select number of those available.
Can I just share, I had an encounter with the fire department at Northbrook yesterday with my 19-month-old grandson who's crazy about fire trucks. And so I'm talking to the firefighter, and when I said I was from Rockford, and I said, you know, we were talking about how the fire department operates, and he goes, "Oh, Rockford's doing some real creative things, aren't you, with first responders and mental health?" And I'm like, yes, the word is getting out that we're doing some good stuff. And I thought that was great.
It is great.
It is.
Yeah, so it was kind of an informal site visit. We went there to discuss the outcomes forms with the 911 center in the Rockford Fire Department. And we did get to see their new software. It is operating now, and we saw them respond to live call with the new software system, and it really does transform the way, I mean, I don't use that word lightly, it completely dynamically changes the way that response is done. I mean, it was really incredible
That's
compared to
exciting.
when we went several months ago and saw the way it was versus now. It really gives the information that's needed in real time for a first responder to appropriately respond to mental health calls.
It's great. I would almost be interested in going back because.
That's true.
Yeah.
I love another
You know,
demonstration.
Yeah, that software is really fantastic. I checked the other counties like DuPage, and they don't know anything about that. So you can do that, but yeah, we are doing that.
Yeah.
Amazing.
It is a big deal, and, you know, it's one that we thought long and hard about, but.
Yeah, because of, price. Okay.
Ask one question, Mary.
Oh, certainly.
Way back, Jason, on your monthly activity report, seems like we're doing well with communications, but what's the status of this request for quote of the communications specialist? That's an ongoing.
Yeah, we received all the quotes, and we've done a prioritization matrix of reviewing them according to the criteria that was established for what we were looking for. And so that should likely be finalized within the next several weeks, I would say, to actually have someone selected and started on that project.
Talking about communication, I went to, I guess, a training for Iris.
Oh, yeah.
And it was interesting. There was a lot of participation. You know, the school district was there, Rosecrans was there. There were a variety of organizations. But what kept occurring to me while I was listening was, it's great to put somebody in touch with somebody who may have mental health resources. The problem is just that it doesn't really get at the issue of inadequate supply of on the ground therapy resources. And I kind of, while I think it's a good sort of skeleton of an infrastructure, we're still missing some pretty big pieces. I kind of feel like they're maybe putting the cart before the horse. I'm not sure, but at least that has to do with communication amongst providers.
Right.
So down the road, hopefully that will flush out into something useful in the community, particularly for kids.
Yeah, because there's been, I think, a very good buy-in from even the health department. Agreed to.
Yeah, the health department was there.
Yeah,
Yeah.
so it's kind of a central connector for.
That, yes, and it goes back to where do you put the information so that a broad swath of people have access? And especially now with the newspapers sort of fizzling out in terms of being a communication resource. Send it to WNIJ. I don't know who you send information to anymore, or how you post things.
Well, this kind of gets back to Ed was talking about, it's always that need to centralize and be able to have the resources. However, then again, it gets back to who's going to update this and who's going to be in charge, because every month or every week things change and they have to be taken off and new ones put on, and so it does become a maintenance concern too.
One thing I wanted to discuss was, I know we have a shortage of clinicians. And so even for the next funding cycle, probably next year, whatever, just something to think about, trying to have something in place or try to look for programs that could kind of help mental health until we get clinicians, because we have a lot of money on hand right now, and we need to get that money out to the public. And we're holding on to a lot of money because people aren't able to hire clinicians and they're not able to utilize the money that we have. And we just need to, people need help, beyond clinician help, and I hope that we can fund some programs that can help those people, especially the kids and the school age kids and stuff like that. I just don't want to go into the election cycle with a super surplus of money.
One of the things I know I've talked to Jason a little bit about is instead of waiting for organizations to come to us with proposals, possibly as we're doing this sort of, relook at priorities, maybe us approaching organizations with targeted requests. We will provide X resources for you to do Y service that we identify. And I mean, it's sort of a different way of working than we initially embraced, but with that in mind, that, there are still gaps where we're not getting proposals. And there are still gaps where we know we need things that just aren't getting addressed. So
I think,
We can meet the providers in a group. and have that discussion, I mean, what our needs are, how they can meet that and what we can do to provide help, so everyone knows what is going on, they are on the same page.
Yeah, we have done that sort of community review, and we're doing it again so that we know what the gaps are. But it's hard to get organizations to step up to do something really new or really different.
Well, I still go back to your concern that, yes, staff shortage has been absolutely the probably #1 barrier for these programs to get off the ground. However, that's the focus that I'm hoping we can help with is, really looking at the possibility of a social work program at the School of Medicine, because they're talking about it seriously. And if we grow our own social workers every 4 years, the likelihood of them staying, because I heard the percentage of the doctors
It's
that
huge.
are staying
Yes,
here in Rockford from, the family practice. And it's big, it's a large percentage. So I think that rather than just scattering, the dollars to smaller programs, that maybe we need to look at legacy programs. I think this is something we're gonna discuss for our strategic plan too, right? This summer when we get together, because I think that's the direction, at least from my perspective. We need to really sink some foundation into creating a workforce here. Yeah,
well, and let's not overlook NIU, because they also have a counseling program, a master's level counseling program that.
Yeah, so some of those are along, like building a master's level counseling program in a pipeline for counseling is a multi-year, decade-long strategy, because even if you build the program, it's, from your high school or graduating today, getting back to the concern of Tim, one of the things that we discovered, we had our first convened mental health pathways committee, which we co-convened with the workforce connection. And there are the crisis peer recovery specialists. Actually, one works for NAMI. Danielle brought that individual with, and there are community colleges across the state that have these programs, and there is not one in Rockford. They only take 2 semesters worth of education, I believe, 1 semester, 2 semesters worth of college level education for somebody with lived experience to get this credential. They get a paid internship from the state, $15 an hour. They get the experience they need, they're plugged right in. What's significant about this opportunity is the speed at which somebody becomes credentialed, opening up to people with lived experience rather than just your 4-year.
I think Jeanette
And
left the board for that reason.
She did.
Peer support specialist.
Jeanette's in that program.
if you look at what the state is doing with 988 and crisis response, they are basing their mobile crisis response teams on the availability of the peer recovery support specialists, because those teams will deploy with a credentialed licensed staff and one of these recovery specialists.
Right.
So that's I think one of the quick win opportunities for that particular need, while maybe building the longer term infrastructure of the 4-year and graduate program here.
So how do we support that in Rockford? How do we make that real?
Well, the first, I think, so we've already started the data gathering component with the Mental Health Pathways Committee, which includes the colleges and universities and the clinical directors of some of our providers. So the question is, who would you hire if you have them available? What programs do you have that create that person, right? That create that credential that you would hire? Identify the gaps that exist in that ecosystem. And then secondly, I'd say as we formalize an updated strategic plan, what we would need to do is probably think about if we want to create a new budget line item for those types of special projects, that you have a prioritization of maintaining your community support system, those programmatic elements, and then have something for special projects where you could do very specific asks for programs that fill this kind of ecosystem gap of mental health workforce development.
And isn't the workforce interested in, they have some.
The Workforce Connection also has funding available for training programs, so there's some things they might also be able to do within their budget to immediately develop some of these training and credentialing programs, not necessarily the 4-year graduate
Right.
program.
Right.
Yeah, no,
Did you get any kind of interest from Rock Valley, for example, and or,
Yes,
okay, so, and typically, how long does it take them to put something into their curriculum?
I don't know that.
Okay,
That's a good question for follow-up.
okay.
but now you said that Rockford College has a new program. Is it Rockford or?
Rockford University has Linda, you can correct me if I'm wrong, but they've developed a bachelor's degree in human services that started this fall. It's the first time they've had that programming, and my understanding was it's 100% online, or it can be online, I believe,
I think so.
so that it is able to reach a broader audience.
Was Rockford University there when you were talking about
Yes.
this? Do you know who it was?
Elaine Sharp.
Well, one of the other gaps in that pipeline can be the money that it takes to attract and keep people.
Yeah.
Having come out of that residency many years ago and staying here, a whole lot of people didn't also. So once you create the educational pipeline, opportunities have to be there and the money to bring people on board,
Right.
which may be where we play a role. I mean,
I
to Tim's point, you know, we have a lot of unspent dollars in a lot of programs because the programs have the dollars, can't find the people. Lining up the dollars with the right professionals to get in the right positions, maybe a role that we play. But just going back to Wendy's point, and I think Mary Ann's too, and Jason, I had the same conversation. I think June is a perfect time to begin not begin, but to have more conversation around the proactive versus reactive role of us.
Yeah,
It seems like we're there now,
right.
you know. The other, if I could just generically make another comment about June that it strikes me that we've also talked about is it seems like we have funded a number of extremely important programs that we all are aware of that don't need to be named that will never be revenue producing.
Right.
So do we at some point as a board reach a point where we say there are these programs that are creating so much value? And it isn't a carte blanche. I mean, there's reporting, there's outcomes, but we understand that a portion of this money will go towards continuing to support critical, basically infrastructure type mental health programs that meet the needs of individuals that will never produce revenue. They will always need this type of support. Seems like we're getting close to that point too, being able to
So it's spelling it out.
isolate, yeah, but spelling it out, being clear about it as a board.
So it seems to me, in light of what you're saying, which I think is wise and everything that everyone else has said, that the key phrase is ecosystem. How are we building,
Yes.
you know, it's almost like world building, you know, what are priorities? What are the metrics we're going to use as it relates to, hey, some stuff we just know that this is what it is until we get the infrastructure right. At the same time, to something you were saying, to the extent that there's money available, but the human capital is not, to what extent can we find ways, and this back is something I'm always talking about, is the marketing and the culture sort of situation, because the reason why people stay or leave isn't always the money. You know, and we know that from the educational system. Sometimes it's the culture that's created, it's the sense of community and all those types of things. Some of that is not an issue of grant money, it's an issue of connection.
That's right.
Right.
Leadership.
And leadership and all that kind of stuff. So this ecosystem that we're trying to create, yes, we control some money and we got to be mindful of how that plays out politically, you know, in certain cycles for our continued health and growth. And at the same, so I think there's some opportunities that we sit down and think about it strategically in terms of long-term pipelines, sort of intermediate, sort of quick wins, some innovative things that we can do right now in terms of recruitment and retainment of seasoned people, maybe from outside of this community, you know, to deal with some things so that ultimately the ecosystem starts to form like we want it to form.
Yes, and
But,
you know,
excuse me. You say you got a hiring problem. How much you pay to your tax? And what are the qualifications?
that's a good question. I mean, that is one of the issues, you know, so one of the problems, for example, in recruiting a child psychiatrist in particular, has been, you know, let's say you have to pay them, I don't know, $200,000 a year, somebody with a board certification as a child psychiatrist. Great. The ecosystem won't support that salary, let alone the requirements of the office and all those things, because people who need those resources often have no insurance, or, you know, the kind of insurance that doesn't reimburse the cost of the hourly reality of running a mental health practice. So that's where we, in my view, I think of that as a capacity opportunity. We can create the capacity for a well-paid child psychiatrist to set up a practice by funding the bones of the practice, you know, paying the housing costs of the practice at one of the local hospitals or whatever, and just putting that out there and saying, if you come, we're gonna count on the hospital being able to pay your salary, but we will fund the infrastructure around you to make that continue to be real. And we may need to do that with other kinds of professionals.
To get them started.
And it may never be possible for us to pull the training wheels up.
It may not, right? That was my point, is that
Yeah,
the money may be
exactly.
the gap, the money
Right.
may be the gap.
So.
But it can't overcome, I think what Ed is saying too, you know, it can. I mean, to some degree it can, but long term it wouldn't.
Yeah.
You know, the person has to feel they're in a community where they
Right.
feel belonging, they're belonging and they're contributing. But to get someone here, you know, money may be a differential for an organization that's having trouble with hiring because they can't afford even a market-based compensation for
Yeah.
something. Maybe we have a role there.
And so you think about it like a team. So there's certain in professional sports, you know, money plays a part, but who you get to play with plays a part too.
Yeah.
Somebody will go to some team because, oh, so-and-so's going there. Okay, well, we can actually get something done type of thing. So it's those intangible things that the ecosystem has to take account for, so that we're marshaling all the resources of the community, not just the money. Not the money is not the important.
It's
But
step
it's-
one.
But there's some other things in there, like, man, you're not making 200,000 when you come here, but what does 100,000, what does 150,000 get you in terms of housing here as opposed to Chicago?
Yeah.
You know, it's stuff like that where you can look, and now you can make an argument with somebody as it relates to quality of life and pace and.
But then the rest of the
Kind of stuff.
conversation is, what kind of community are we can we create around people we're pulling
Yeah.
here?
But we're not going to be hiring people or bringing people. We've got to affiliate, we have to make sure one of the organizations that has the wraparound services, other than the doctor will see the patient for only very medication or whatever, but the treatment piece of it, we have to have more than the doctor for child psychiatry.
Right.
You know, so it's really working with agencies and organizations that are in the business, because we can't just begin a practice. I mean, that's,
Right.
it's a board. I mean, that's not gonna happen. But we have the money to help fund positions. And that's, and we have to make sure that they're in a appropriate setting. And if they can attract other people, as you say, that are, you know, if Dr. So-and-so is there, I'd like to affiliate with that organization. Tim?
So the other, to really focus on what my main concern and to add in the ecosystem, it's like organizations like the Mentally Unchained that is going on at the Norlaw Center, or like some other things, we have to allocate some money so more events could take place like that. That way, that's, and my concern is reaching the voter. I understand you all see people and everybody, even when you said the first responder, those are the same people that's working. We have to convince the public that the money is going well, because when you look at comments on social media, they don't believe in the mental health board because their concern is low income people still aren't getting services, even with the mental health taxes. And so those are some of the comments on social media when you see it. And we still have to be concerned about that in 3 years. And when you go, when we go to the polls and ask for people to renew this tax cycle, and they see we have a surplus of money that we didn't do anything with, what reason do we give them to vote for this program again? So with this program is not locked in like the health department, the sheriff's department, or any other department. We have to go renew our, or get elected every 6 years. So this program has to be treated like a political program. We can't just always treat it like a long-term corporation, because it can leave at any time in 6 years. And right now, when I hear people that don't like the program, especially county board members, they got too much money just sitting there and they're not doing anything with it.
Well, I don't think the county board necessarily understands that the money is sitting there.
But see, that's what I'm trying to tell you.
Yeah.
They don't understand. So we have to make them understand. We have to give them reasons to understand.
Yeah, because we can't.
Otherwise, they're
spend
gonna
money.
tell their constituents not to vote for it.
Right.
So it's up to us to sell it to them.
Tim, they told their constituents when first time not to vote for it, and the voters voted for it. So I do have to
I
say.
understand, I understand.
But I think that's the
But
voice
this-
of reality.
But
Oh, but I agree.
we're
I
giving-
agree
we're
that
giving them-
people are saying-
we're giving them something
Yeah.
that they can argue against the board.
Yeah.
I agree.
I don't wanna give them that.
I get it.
One reason I wanted to ask Jason about the communication specialist, again, the conversation he and I have had is along these lines. That become focused on the voter in the next 3 years
Yes.
and getting the word out with these great events, you know, the sports factory. I understand where some of the county board members are coming from, but they're not the entire voting electorate. I think that Tim is spot on though about being concerned about it.
Oh, I agree.
We could sunset, we could go away, and the surplus is an issue. It will be made an issue. But we need to have the community understand that, you know, you don't take a community like ours and you kind of snap your fingers and in 2 or 3 years, you completely turn everything around. And everything's cooking on all cylinders. All the money is now being used because everybody's been hired. That's not typically how the voting public reacts to things, though. They react more to sound bites. So these people have a lot of money and what are they doing?
Right.
So that's the political sound bite.
Yeah,
And we have to work harder to counteract that, and they have to work to just put that out there and say, we got a lot of money, what are they doing with it? That's it.
and we have to work doubly hard because COVID slowed
Yes.
everything down for 2 full years.
Exactly.
And people forget it quickly.
That's right.
They forget that.
And that's why I was getting at, like, supporting those small little pockets. Those events probably $5,000 here and there. That's nothing compared to, you know, supporting those small events that people could see will keep the voters on our side. And it can't just be just the large things. And we have to, because sometimes those events don't come up, you know, and they don't know about the event in December when they have to apply. So we have to put something in the budget so they could come to Jason and get something throughout the middle of the year.
Yeah.
Okay.
So that's what I was saying.
So, and maybe we, again, need to be proactive and go to some of our organizations and say, we would like for you to put on an event in the month of September, around mental health for kids starting school. You know, go to, I don't know where, NAMI, and say, let's put something on and let's promote it to family members
Yeah.
or.
I think so, I mean, as a separate issue, when we talk about being reactive versus proactive, I think we also have to think about what public procurement requires and what type of bidding is allowed for anything that we're purchasing. And so, you know, I would say that needs to be a question through which we also consult our legal counsel. I know we can, a government entity such as a mental health board can form an intergovernmental agreement with another government entity, not necessarily through a bidding process, but to just go to a nonprofit organization and say, we want you to do something, here's the money for it, is that's a different question, right? That's a different thing. And so, you know, I think what Mohammed was saying, we can convene organizations and say, here's what we would like to do. And now we are going to create a funding mechanism to receive requests for said thing and get proposals that way. But to just say, here you go, here you go, here you go,
Right,
that's a different.
yeah, I worry about that too, just handing money out. I mean, that's not ours.
So that's what I was saying, like, we have to establish it in the budget. Like, say we do $100,000 in the budget to where somebody will come fill out an application throughout the year to R1 to get money for a specific event that they want. And that event could be advertised through to the public, that they could apply for this money for mental health awareness events, just like the county does with the host fees. Those monies are budgeted every year and allocated to where they could come, the public can come apply for economic development money. So a business need help with the money, so they have to come to the economic development department and they apply for that money. And then we'll vote for it on it as a board, whether they get that money or not. And most of the time they will, but that's just how it goes. We don't have to wait till the beginning of the year in order to give them that money.
So in other words, just put a line item in our July 1 budget.
Right.
For
Promotion and awareness.
mental health awareness.
Event planning, I mean, because it could be the same contract with communication in terms of another subset of it, of planning for event planning on an annual basis to reach different constituencies within the community.
Yeah, so, I mean, you know, Dick, you got me hooked on this conceptual model and I can't get it out of my head. Promotion and awareness of mental health is part of the community support system. We haven't created an independent line item for that.
That's what this discussion in my mind really represents.
It's very well.
You know, in terms of, that's what we need to do. It's as much a part of it's as much a part of the therapies as it is, because again, what we're selling is a system.
Right.
Okay, I mean, and so we gotta do those things that in a sense show the system in its development. And it's the ecosystem that what we're saying is, stay with us through this. And what we're gonna bring you is something that will touch all the different parts of the community where people have these needs.
Okay, Linda.
It sounds to me like we're talking about two different things. What I was hearing Wendy say is that perhaps we think about doing some requests for proposals. So we
Which is different from
identify,
this.
right, well, right, so these are the two different things. First of all, we identify a need in our strategic plan that's not being filled, whatever that is. And ask agencies, you know, tell them we have this much money available, please put in a proposal to meet these outcomes, which fits into our strategic plan. Secondly, then I think that is a good idea to have a rolling line item that has money in it, so that if someone comes up with something, they could apply to us on a rolling basis and the board could.
Right.
And the expansion of that would be, so let's say we're creating a line item for, community awareness. There are opportunities throughout the year where there are already community celebrations. I'm thinking, so there's a Juneteenth celebration that the park district sponsors. There's I think it still exists, the Roro Expo up in Roscoe, where they do like sort of a community, or the fall festival. There are all these like little opportunities scattered, Cinco de Mayo in the Hispanic community. There are all these opportunities where somebody who's coordinating community awareness could be present at those events with some sort of booth and materials to enhance community awareness and have, things that say, these are the things that are being funded. These are the things that you can use to help your, families and things. So in other words, we're having a communication problem about what agencies are doing. Maybe this is one quick and dirty way to get information out to the community.
But again, who's gonna do that? I
Well,
mean,
that's what I'm saying, if
yeah.
we're hiring a communication
Yeah,
organization, and then if NAMI comes to us, or Rosecrans comes to us, or whoever it is, U of I comes to us and says, we'd like to do an event. We have resources to do that, and let our participants know.
we can't forget that in a way, we've already begun this process in terms of asking for proposals. I mean, our priorities, we had
Right.
housing, we had detox, we had, substance abuse treatment per se. And that's why we had abstracts, because we did not want to fund programs that were not really strategically in line with, our plan, and that would be drift. And plus, funding small programs and monitoring the outcomes and all the work that goes behind the scene. It is, we're gonna get to a point of no return on that. You'd have to keep hiring more our own staff if we're gonna keep funding more little programs. So that's why I think it is really important that strategically we're going forward, we have to think about the dollars, how many we have to really establish something that would benefit the community way beyond our time on this board. And that's been my goal all along, this system of care, to be able to think that, it's there forever. But we'll see.
Yeah, so maybe that's even thinking about, a request for proposals for an education or a certification program.
Right?
Well, it sounds like it's already in the.
Well, except we would fund.
Right.
Pathways.
Yeah.
Yeah, the wheels are in motion. We haven't determined what the funding mechanism would be for those types of things. It's through the same grant program where the request for proposal very specific to one ask.
But it is interesting, isn't it? I'm thinking about some of the proposals I've read over the last, couple of months. There are a number of sort of, I guess, paraprofessionals that are being utilized in programs to sort of extend the reach. I guess certification would be sort of the next level of resource in the community to bridge the gap.
Yeah, in addition to there being a mental health workforce shortage, there's a people shortage.
Right.
Every industry is
Right.
suffering from the same problem all at once. So
Absolutely.
it's not as simple as, finding lower credential levels, because you still need a person.
Yeah, because that pediatric situation, that's a national situation.
It is.
Yeah, that's not just,
Oh,
it's not that easy.
I just, going back to your, that this system of care is created and survives all of us. I just keep going back to Tim's comment that we're part of a political process, and I don't think we can lose sight of that.
No, we can't.
And I'm hopeful that one of the charges to the communication specialist is to take that on. And I'm assuming all sorts of segments of our community who will not be or would never go to a May 5th event at the Sports Factory. So how do we get out into other parts of our community where it's easy to spread the word, these people aren't doing anything, they got a lot of money, but you have to get more granular, I think, with people and where they're coming from, that this is what it's doing.
That's right.
And the more you can say, this is what it's doing for you, and make an example at home, do you realize that in your community, this is happening? People go, oh, okay, I get it now. Basically, large systemic things, I think it's very understandably hard for people to grasp that.
I agree.
So when it becomes real is when you can demonstrate it's had an impact on individuals.
Yeah.
That's why I really believe we've got to think through something where we in a sense create the communication. And that the communicator has got the passion for the system issues that we face. Tim, I mean, just as an example, already we've changed the core in this community in terms of management of crises. But these are not the kinds of programs that are going to show up in a neighborhood event.
No, it's
okay?
not.
I mean, because the 911 piece.
Right.
But-
No, the part with Swedes in the fire department, the co-responder programs.
See, but those programs,
in the sheriff's department.
I want the sheriff to stand up and talk to us as a community about how the mental health system is impacting what's going on in the jail.
Right.
And what kind of positive budget impact there's been,
But the-
because we are not locking mentally ill people up at such a high rate.
But Wendy, the only thing part I have with that is it's still silos. Because now the sheriff is talking about the thing in the jail. Where we've got to go is the systems issue, the fact that the interrelatedness.
We know
okay. Well, but I mean, but that's what's got to be
The
shared.
community doesn't. know
The
that.
community.
We have to
doesn't know that.
Well, because we're really talking about the fabric of the community
Right.
in terms of an appreciation for kind of things are different now than what they were
And-
before this half-cent sales tax went in.
So that's how what we need to
It's
identify.
really different, but I don't discredit what Wendy said, because the
Yeah.
sheriff has a strong political following.
Yes, he does.
So he's still.
And we get Carla Red out there because it's changing how her
Mhm.
officers are functioning in the field. And let's talk to the emergency room, people who are fielding things differently with their, emergency responders. They're handling people differently. Are we getting fewer people in the emergency room? Are we getting a better response to people who are being brought into the emergency room because we know more about them? I mean, there are things that we can ask the organizations that we're funding to tell us, and let's communicate that, because the sheriff and the police chief and the mayor.
They are telling us this, if you.
Right, but they need to say it in the community.
They're telling us to
Right.
get refunded.
Right,
They're
but
not
now we
telling the
need
public.
to.
Right,
we need
that's
to
right,
broadcast
exactly,
this out into
exactly,
the
exactly.
community.
Cause that CCRT program, that's like a major bonus for the Winnebago County.
You're darn right it is. And one of the greatest things I heard when I went to the site visit was that now people who I would call frequent flyers in the criminal justice system get into a problem and they go, I want that officer from the CCRT. I'll talk to them. And crisis averted. Maybe an arrest averted, maybe a trip to the hospital instead of a trip to jail. That's saving taxpayers money.
But I think getting back to, I'm writing this pony about the voters.
Yeah.
I think we're at a point of maturation here where I'm a huge fan of storytelling. I mean, if you can get individuals
And
Not,
they have
not a
them.
sheriff or not
Oh.
someone from a system
Right.
perspective. But have people think of when Jason said, well, at the event on May 50th, people who jumped off the Golden Gate Bridge, so they're gonna come and talk about their particular experience. That's incredibly powerful. I tell you very quickly an anecdote. When I was still at Swedes and we were not debating, but discussing with Chief Burst and the mobile integrated health program. There were stories, people who called 911 200 times in a year, and they all came to Sweden. But, there's one individual who had asthma and diabetes and was calling repeatedly, primarily because during the summer months, they didn't have air conditioning in their little one room. Well, we figured out how to get them a window air conditioner in their 911 calls. And you tell that story to a board of good people, they go, that's how it works. I mean, that averted all that stuff. Yes, it did. You know how much a 911 call cost to the city of Rockford when they send a crew?
Right,
Cost them that much?
or the ER visit.
Yeah,
And
or
this-
the ER visit, because you have to bring them in. You have to, once they're there, this is what it costs. There's no reimbursement for it. But it began with storytelling.
Mhm.
And I'm sure we have enough stories that
Yes.
of willing people, possibly of that person from the CCRT who can say, yes. Not the official, but the person themselves who's positively impacted.
Or the
To give a
officer.
testimonial, or the officers.
One of the things they said, they had one call and it resulted in like 57 individual contacts by CCRT people. But none of those involved an arrest or a hospitalization. It involved stabilization. And you're right, those kinds of stories speak a lot.
Very powerful.
So maybe
Okay.
we'll work on that.
I love your statement, Bill. So I'm gonna ride this horse one more time. That's what I mean by having a communicator who goes around looking for stories.
Yeah.
Yes,
Okay, because the sheriff's gotta be prompted,
right.
okay, to either he or get, Tony Ponte or other people, in order to say it, and it's gotta be regular.
Yes.
Because otherwise we lose it. So, that's turning out to be as important as any therapeutic program that we're funding these days, because again, it's the way we get people to appreciate the services that are being brought to bear.
So we basically, to your point, I agree with everything that's been said. We just have to get it framed in our mind and figure out how to implement it in the
That's
budget.
right,
That we have an ongoing campaign.
that's
Just
right,
like the campaign to get the
that's right,
half-cent thing, we have to have an ongoing.
right.
Well, I think
Well,
we should clarify that with our legal counsel.
Yeah, I
About
hear you.
what we are talking about, because I understand that they're interconnected goals, but the idea of promoting the funded programs to the community and talking about campaigning for the tax are separate things. And I have not received clarity back from legal counsel yet about what the board's role in that campaign.
You don't call it campaigning,
That's
call
right.
it community awareness.
Well,
Be
That's
clear,
what I'm
just
saying.
be clear for the
It
record,
should be-
what I meant was a campaign for community awareness
Marketing
as relates to
That's
the,
right. That's
as relates to the
right.
system of care. I'm not talking about campaign for
Right.
whatever
The
we
sales
talk
tax.
about.
That's right.
It's the communication specialist. It's just. That budget has more than just what it costs for the communication specialist, and there's some latitude now.
Yeah, so the communication specialist also, so that we're back on the same page, is like, we formed the communication work group to essentially develop the theory of what promotion and awareness of mental health for our funded programs should be. That developed some recommendations for about 8 communication requirements, which will be added to this year's funding agreement contracts. Prior to this year, there was no requirement for funded agencies to do communications around their funded programs. Some have done that. There'll be specific required things they must do now. And then the specialist will develop those co-branding, so there's consistency of messaging and look. So when you see it from Ramp, you see it from NAMI, you see it from Rosecrans, it's gonna have the same look of this is a mental health board funded program. And you see that consistently across 30 to 40 agencies all putting out their communication. I'm not saying there's not more we can do, but that's what's already established that's happening right now.
Okay, and on that note, any other, are you making the motion?
Yes, ma'am.
Okay, do I have a second?
Second.
We need to roll call. All those in favor, please say aye.